Good morning. I'm Jeff Flax, the President and CEO of Hartford HealthCare. Today, this is a monumental moment. This is a monumental moment in time. We're turning the page really to the final chapter. We think back to being here in March of 2020 when we first stood up our testing location here in the convention center. And then shortly thereafter, we built a significant 600-bed temporary hospital, field hospital, right above us. And then this past December of 2020, we stood up our first vaccine center here. The convention center has been an incredible partner. It's been an incredible location. The difference it's made in people's lives across the community, it's really immeasurable. We were doing north of 1,600 plus shots a day for vaccines here. And to now be in this moment, where behind us and around us today, we're really breaking down this center. It signifies an enormous moment in progress in our community defeating this virus. When I think back to what's occurred here, we're going to be crossing over in the next several days 500,000 vaccines that have been delivered through Hartford HealthCare. We've done now more than 1.2 million tests. And these aren't statistics. These are people. These are human beings. These are lives we've touched. And I could not be more grateful to my colleagues at Hartford HealthCare, the people who've stepped forward, the courage, their bravery, the way that they've served our community in this moment, and the way they've partnered with our community. It's really, words are difficult to describe what it's meant in this moment. As we come forward today, it's important to recognize this is about evolution, and we are going to continue to be better than we were before. I've said throughout this crisis that we need in healthcare to be better than normal, and as we move from the max vaccination centers to mega centers, and this convention center was the first of its kind in Connecticut, it's an important step in progress. But what we've created is a mobile health company throughout this crisis, and you see the vans to my left. The work that we've done with the community, the partnerships we've developed, we've sent our mobile health teams out more than 2,000 times to prisons, to homeless shelters, to community centers, to churches, to various parking lots throughout Connecticut. And we have recognized that this is a permanent solution. This is about improving health equity. It's about improving to ensure that no person, no community will be left behind. And really today marks a turning point for us, a pivot. So we're moving from these these large locations, these mass vaccination centers, to now developing our community approach to where we're going to connect with each person through these community partnerships and alliances we've created. But as we recognize today, you have to appreciate the tens of thousands, and really in this center, nearly 1 million people who've come throughout this process, through testing, through vaccination, and through our hospital that was created. I want to invite Karen Pagliaro, who's run this location for Hartford HealthCare, to come forward. And Karen has been absolutely incredible, absolutely incredible. The difference she's made. You think about what we've asked people like Karen as leaders to do, and they've had to step forward and build hospitals, testing facilities, vaccination centers with effectively no notice through unprecedented circumstances where safety needed to come first, but access was king. And we've done an amazing job. And Karen, we're incredibly grateful, and I'm so proud for you to come forward and to really speak on behalf of all of our colleagues who've worked here and have done just exceptional work. Please, Karen Pagliaro.
Thank you. Thank you, Jeff. Thank you. Good morning, everyone. On December 28th in 2020, I, along with my team, walked through the door. We really didn't know what to expect. I mean, we were all nurses. We knew how to give vaccinations. We've been doing it right along, but this was different. This wasn't a flu shot. It was so different, so we really didn't know what to expect. And then our first client walked through the door, and it just all came together. Each of us worked together, and it's not just the nurses, but it was the administrative people. It was the person who screened the person when they came in, and then the people that were in observation, talking to and watching people after they've gotten their vaccine. And certainly the convention center staff too, because without them, we couldn't have made it. I know it's an old phrase, it takes a village, but here, not only did it take a village, but it meant that we became family. And then when we started to see our clients, each person brought in their own story. And some people came in really excited, let me roll up my sleeve, I can't wait to get this shot. And then there were others who were nervous and sad. We had tears. Our staff would hold people's hands. And you know what? We even gave hugs too. But there's one crystal moment that I had when a woman came in for her vaccination. She didn't realize that she had to wait 15 minutes. And so one of the staff members brought her up to me, and the woman said to me, I can't stay, I can't get my vaccine today, I'm so sorry. And I'm like, well, why? What happened? She goes, my medical taxi cab is outside. So it was an older woman, and this taxi cab was outside. So I looked at her, I said, come on, let's go talk to the taxi cab driver. Together we went outside, and guess what? The taxi cab driver hadn't gotten his shot either. So we brought him in, we brought her in. They wanted pictures taken. She got her shot. She literally danced to the observation center. She was so excited. He got his shot. They stood in front of our sign that says, I got my shot. And then a little while later, she called me over and she was crying. And I'm like, what happened? And she shared with me that her daughter, who is in the military in the Carolinas, had said she wouldn't get a shot. And when her mom called her, she said, Mom, I'm getting my shot too. So from one person, we gave 3 people. And that to me was one of the best stories ever, because we made a difference. And that's what Hartford HealthCare is all about, to make every moment matter and to make a difference. So thank you all for your support. I appreciate you. It's now my pleasure to introduce Dr. James Carden, who is the Chief Integration Officer for Hartford HealthCare. And by the way, he's been on speed dial. He's been a rock for me, and I really, really appreciate all that he's done when he stood by me and really mentored me. So thank you, Jim.
Wow, that's too bad. Thank you all for coming, and very proud to have been part of the team that led this effort. Just to reflect for a minute about Karen, we had an opportunity about a week ago to meet with the entire staff here. We had a little bit of a wrap-up sort of recognition. And although Karen talked a lot about what was accomplished, as you could already see how she spoke, it was much more important with how it all got done and how we treated each other and the folks that trust us with their care. The recognition that Karen received at the meeting last Wednesday was remarkable in that most of the people who came to work here had never worked together, didn't know each other. Yet by the time they were leaving, they were not only close friends, but had been through something that was really transformative for them. And they all spoke about the opportunity to participate in this kind of effort was just a lifetime experience for them. So that is in no small part to the leadership of what Karen, other leaders across that we had the pleasure to work with, really brought forward, and it was very encouraging. I do want to speak to that this is not an ending. This is a transition and a pivot. We knew this day would be coming, that we would not need these large sites to vaccinate folks. That doesn't mean our work is done. We have more vaccines to administer. We are migrating to a more distributive, smaller sites. We have 17 sites across our footprint, all of them available for people to walk in if they so desire. And we will continue the efforts around mobile to get out to the communities to make this as accessible as possible. We still have a great deal of work to do to continue to socialize the need for vaccine and the benefits to it. We've got education lift that's on us to take away the concerns and the risks and the hesitancy that we know exist. This is, the point in time we knew we'd get to. This last bit is going to be the hardest, and we just need to be completely attentive to it. From our perspective also, this has been an enormous learning opportunity for Hartford HealthCare and for us in understanding what our responsibility and our opportunity is to really continue to connect with the local communities we serve. What we learned from testing, what we learned from vaccine administration, working with local health leaders, community leaders, the local health departments, has given us a door and an access point to where we can continue to leverage what we've built to really deal with a lot of the health inequities and disparities that we know exist in our communities. That's for us to do, and we are completely focused and pivoting on moving forward with that agenda. So this doesn't go away. The work we've done has been really helpful, and it's transformed us and what our capabilities are. So with that, we're excited about the future. We think we're coming out of this better than when we went in, with much better opportunity to care for the communities that we serve and really give them that personalized, coordinated care we're committed to. With that, the lift goes over to somebody who I don't even need to introduce, Keith Grant, but I'd love to do it. He has been an absolute unbelievable partner, and his vision, thoughtfulness, expertise, complete availability. Karen says speed dial. I don't think Keith sleeps, so that he has been just a remarkable partner in this, and it's a privilege to work with him. So Keith.
Morning, guys. Thank you so much. So, when a few months ago, we started having a discussion as to what do we believe that's happening in China, right? And within that discussion, as Hartford HealthCare, how do we start leveraging what we have within the community to be as helpful as possible? So we recognized that information needed to go out. And we formed a call center, right? So, which was one of the first in the country. And in the first few days, that was accessed across the country. So many people accessed the call center. And the primary purpose for that was to ensure that the appropriate information was going out. And that was very helpful. And way before the December 11th, when the vaccine was initially approved, we started having a discussion. How do we ensure that vaccines get out into the community? How do we ensure that our responsibility within the healthcare, in Connecticut, our responsibility is fulfilled by delivering, and we made a tentative number, which we're reaching right now. So we did a calculation, and we said we need to deliver over 450,000 vaccines in order for us to be purposeful within the state of Connecticut. And we talked a lot about herd immunity. So what was our part to play? And I know we identified that the work is not completed, but a lot has been done. So a lot has been done, and I know we talked about identifying, needs within the community and partnerships that we've created and new opportunities that we've seen. So a lot of work has been done, but it's not done. I agree with Jim, it's definitely not done. We see, and Jeff started a new statement, which is better than normal. And, we see the need for us as big and as successful as Hartford HealthCare has been to be even more successful in more specific area. And this is where this transition comes in. So no longer is the convention center as a primary area for vaccination, but we will find a way to come to you. We'll find a way to get information out to you, to areas that need this information and needs this access. When you look at the numbers within Connecticut, we can say we're in a much better place. We're in a significantly better place. A lot of conversations about the Delta variants, B.1.617.2. From an epidemiology perspective, is something to be concerned about. If you look at the actual data itself, it's above 40% more contagious. So which means, in perspective, looking at 600,000 individuals who have died so far, if you had this variant in the beginning, we would have significant more numbers. It is also about 2.5 times more likely to get someone in the hospital in critical care. So much more work to be done. One of the most important piece of this is, how effective is the vaccine? And we've had that question a lot. We've had that question before the vaccine, in the process of administration, and now that a lot of people have been vaccinated, and we're still getting that question now that we see no variances. So I think the best data, the best study we're seeing is about 88% efficacy from Pfizer and Moderna. And I normally put Pfizer and Moderna together because it's theoretically the same exact vaccine, same technology. And Johnson & Johnson did their study as well, their review, very small study, but shows it was equally as effective, so very effective. So we do have very effective vaccines. And when we started this campaign with the vaccinations, we thought about approaches. One of the approaches we thought about, should we give information and not say, go get the vaccine, right? Do we approach it that way? Do we say we're ensuring that we're responsible for passing the information on, creating the access, and individuals come in and get vaccinated? I've changed that mantra a little bit by saying, go get vaccinated. Like, we have the data that shows significantly the vaccine, the 500,000 individuals that you've and your team have touched and vaccinated, you've saved countless lives. We've proven that. The vaccine, the efficacy document shows that. The studies within Connecticut shows that. There's been 242 cases in the first 1.6 million dosage that are breakthrough cases. And if you look at that statistic, that's pretty significant. So we're in a much better place. I do think, with a lot of effort for the individuals, getting to the individuals that are not vaccinated, the prediction for going forward, a lot of questions about the boosters. I stand by what I said in the beginning. I don't think we're going to need boosters for a while. I do think when we do need boosters, like everything else, this team's going to be prepared to deliver that with communication, with access, and with the appropriate statements. I do think we're in a much better place. I do believe strongly, and the data does support that if we continue to do what we're doing right now, just be aware, we should have a much better summer, continue to have a much better summer than we did last year. And we should have a much better Thanksgiving, and definitely looking forward to a much better Christmas or the holiday season. But again, I want to thank the community for allowing us to help the community to go through this pandemic. And definitely thank you and your team. Jeff, and none of this happens without leadership. And we don't give a lot of credit. I said this before, that this is probably the longest I've spoken, by the way. I normally don't speak this long. But I've said this before, there's a lot that we don't get to celebrate during a pandemic. There's a wonderful technology came out in mRNA. It will change vaccination, I strongly believe that. But from a leadership perspective, there is not one crazy idea that we haven't brought to Jeff that he's like, all right, let's think about this, right? And we figured it out, and it brought over 500,000 vaccines and 1.2 plus million tests. So I really do appreciate that. So Tina and the team, Rebecca and the team, I cannot thank you guys enough. This has been absolutely an amazing journey. I'm very proud to be a part of this institution. I'm very proud of what the state has done. I'll stop there. So.
Questions for the team?
I have a question. Why did you guys decide that now is the right time to take down this site?
Sure, Jim, you want to speak to that?
Yeah, it's good to see you. Really, it was the planning of just the volumes declining here. We're just not seeing the need for this kind of scale, and so it was time to sort of pivot away from it. It was really driven by that. And as we're winding down other operations, all of them, we've looked at it, weeks ahead of time so that we could sort of plan, because we had to make sure we had enough resources in other places to make sure we could fit whatever need we're hitting here. And the timing's right. We've got the other sites set up. This is ready to come down, and so it's just time to move on. I also think that sooner or later, as kind as these people have been, they want their building back. We've taken over their garage, their main display center, and their lobby. I think it's time for us to sort of say thanks very much, but it's time for you guys to go. Yeah, that's all continues to be managed very tightly by us. We always have the second vaccine ready to go. Our second dose administrations remain above 97, 98%, so we don't miss people. And even if they're not going to come back to the same place, we have them scheduled for the other place that they can go. So we've got that pretty tightly managed. Karen, I think we had a good day last week of about 100, but it's been...
Yeah. So we started off, should I?
Mm-hmm.
Thank you.
Yeah, don't want to...
Thank you. So we started off between 100, 200. It gradually went to 400, 600, and the top that we did was 1,600. And as Dr. Carden said, we have been going down. Today, we actually only have 37 appointments, but I do expect we'll have people that walk in, and any of you who need a shot, we're happy to help.
I do want to make one comment because Jim alluded to it, but the Capital Region Development Authority has been an extraordinary partner. And throughout this pandemic, community collaboration and the alignment of people working together has been really exceptional. And in this particular example, from the governor's office to the mayor's office, in particular to the Capital Regional Development Authority, everyone came together, including the National Guard, to support this facility. So for now, well more than a year, this facility has been central to the state of Connecticut's response. And as we pivot to more of a focused access strategy to bring in the community, this center did an enormous job, was hugely impactful, and CRDA really deserves special credit and recognition for their community mindedness.
I'm trying to remember, but it was probably between January and March.
We can get that data.
Yeah, we can get it.
We can get it.
Yeah, please.
So we have continued to fill out the mobile schedules to date. We've done somewhere around 200 or so, and that will continue. And all we are looking for is to continue to develop the partnerships, but that's fully deployed to continue vaccine and testing. As we
send out approximately five teams a day.
We have about 5 teams a day, yeah.
To about 2 different locations.
Right. What we're going to be doing is building that out. What we want to do is ensure that as those sites are, a lot of them have been very targeted to a specific population, but what we're trying to do is make sure that we make them more public so people can just walk up to any place we have a mobile test site going on. So that is also a work in progress to get that calendar built out so that it's more public.
Are those teams still finding people who are not vaccinated who want vaccinated?
Yeah, small. We're a success for us is double digits. As opposed to we used to have 100 plus. But that's fine. What we want to do is make sure we're there until there's nobody who wants to be vaccinated, and we'll move on to the next place. This is a ground game that's just going to be we're just going to be persistent about getting there.
How will you know when it's over?
Data.
Yeah.
It's all data.
Right. Yeah, we're well down that path. That'll be available. Those are serving 2 purposes. A lot of them are just like we do flu vaccine. They take care of their own patients, right? And we have a strong outreach to ensure that anybody who sees us, we'll continue to work through that list in those. It also serves as a reservoir if we need to open up quickly to a broader group, that these practices are available for some degree. They're not all going to be publicly facing to begin with, but they're sort of in our back pockets if we need them. Yes. Yeah, and that's been ongoing work.
It's today.
As Keith, one more question about the Delta variant. Do you think that Connecticut is vulnerable to the type of increasing cases that a couple other places have had, or could our high vaccine rate
Yeah, so I think you kind of answered the question. The high vaccination rate definitely helps. So Connecticut's in a good place in that, and especially in the populations that are most vulnerable, Connecticut's well over 90%. That's really good. So our over 65 population, Connecticut's over 90% for vaccination. One of the things to look at, so for example, in France right now, over the last 14 days, the Delta variants have actually doubled. So they're now, it's about 20% of their entire new cases are Delta variants, about 10% 2 weeks ago. So that's pretty significant. We're tracking very closely to UK from an epidemiology perspective. So we've seen in Connecticut there's an increase. I think it's about 6% of our new cases now are Delta variants. So I do believe that with our vaccination rate, we'll have some level of protection. But with that being said, some key things that we still need to focus on, and we started this conversation with, wear your mask if you believe that, there's certain situations to wear your masking with. If you have any form of symptoms, stay away from the public and get tested as soon as possible. That's very, very important at this point in time. And I can't stress enough, there's a reason why we're all able here as a team to stand without having a mask on. There's a reason why you can ask the question with some confidence saying Connecticut's in a better place. It's because we do have a vaccine process that works. So get vaccinated.
So Connecticut has something like a 70% vaccination rate in the total population, but like the city of Hartford is closer to 40%.
Yep.
Do you think that cities or other places with low rates could be vulnerable?
Absolutely. That is absolutely correct. And one of the most challenging thing for this team at this point, and that's one of the reasons why we're pivoting, is appreciating the fact that there are some communities and some subset of communities that we might need to change our processes that we've identified that might be more successful than having a standing building. And I think the message that was sent to me when coming up here is the fact that we need to talk about how do we reach out to people, and I definitely agree with that message, because that's one of the messages that was sent out even before COVID, that we need to figure out how to expand our reach, and this is a good opportunity for us to do that. Anything else? Any other questions?
With the last group of people being possibly eligible for vaccines, which would be children under 12 years old, we know that's a little bit down the road. It can happen later this year or early next year. Do you anticipate that mass mega vaccine sites won't be needed at that time? There will be other avenues for when possibly those children will be eligible?
So that's a good question. I think one of the things that we will be doing, and we talked about that, is how do we transition? Remember, normal process of vaccination happens within primary care in the pediatric office and stuff, pediatrician's office. So we're going to be working on processes, how to send education and process platforms to these offices to ensure that this rollout will be more consistent, more as normal as possible, but as Jeff always says, better than normal, right? How to get them more involved. Because, in theory, we want from a healthier community, we want that engagement to happen, right? So the engagement is not just relying on the walls of Hartford HealthCare, but the communication with your provider. So we want that to happen. So that might be the primary promotion point. Anything else?
Thank you.
All right, awesome. Thank you.